I just wanted to walk you through what to expect when coming in to have a mammogram. So this is the general setup of a mammogram room. You have your mammogram machine, and the area over to the side is the technologist area. So while the exposure is going on, the technologist will stand behind the glass, the lead that you see here, and take the exposure. The mammogram machine is what you see in front of you. So this is a 3-dimension or 3D machine for a 3D mammogram. And what that means is the tube head, which is the top part here, rotates when we go to take the picture. So I'll bring it up just a little bit so you can see. So in the front of the machine, you have this plastic piece here. This is the face shield. And then you have the compression paddle. This comes up and down. And then you have the detector. So this part here, this black part here, is what takes the picture. The compression paddle comes down slowly with automatic compression, or the technologist can manually crank to add additional compression. For a screening mammogram, even a diagnostic, we traditionally start with 2 images of each breast. The first image is from top to bottom, and the second image is from side to side. The tube rotates, typically about 45 degrees. Depending on the body habitus, we'll adjust the angle of the machine as needed to do the side pictures. So the patient will stand forward to the machine, lift their arm, and the technologist will guide them into the machine and position them as needed. And again, compression is applied slowly to the breast. When you're having your imaging done, you will feel some pulling, and there is some slight compression. There is some slight pressure to your breast. This is normal. You should not be in excruciating pain. If you are, let the technologist know, and they'll let up and readjust. So the 2 pictures are done on each breast, 4 pictures total. Once the images are obtained, the technologist will either ask you to have a seat in the room or in the dressing booth. At that time, they'll check their imaging to make sure everything looks okay. If they need additional imaging, if there's motion on their images, or they don't have all of your breast tissue, they will ask you to step back into the room to repeat the image. After that additional image is done, they'll check it to make sure it looks okay. And then if all of the images are technically acceptable, meaning we have all of your breast tissue and there's no motion, then you're free to go.